Welcome back to Coffee with Coker. My name is Mark Reibold, and I'm your host. In case you don't know, Coffee with Coker is produced by the Coker Group, and the podcast is intended to be discussion around solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape. So with that kind of scripted intro out of the way, if you will, I'm excited to be introducing the next episode this week, and it's episode 6, but what we're talking about is basically a high-level introduction of an overview of the healthcare technology market. And this episode joining me is Jeffery Daigrepont, who is a senior vice president at Coker, and he has been the leader of our healthcare IT consulting group for over 15 years now. Basically, ever since Coker has been in the healthcare technology services business, Jeffery has been leading that group and has grown it tremendously. And I think he's one of the, a well-known, respected expert all over the country as it relates to healthcare technology, and specifically digging into technology solutions in the healthcare services space. So has done a lot with electronic health records, systems, solutions, and vendors, and as well as on the hospital side, whether it's EHR or rev cycle or practice management, ambulatory, etc. So we had a great discussion, and what we wanted to do in this episode was basically tee up the broader discussion, covering at a high level some of the different topics and issues that relate to healthcare technology as a whole. And then this will kick off a series, as we've done with other topics, that allow us to dig deeper into some of those specific topics or more specific discussion items that allow us to basically drill down and provide a little bit more detailed discussion and content, because I know there's a lot here. Again, in this episode, we try to tee up that discussion and kind of talk about the healthcare IT marketplace from a high level. One of the things I think that's interesting about this and about kind of what Coker does here is we have a unique position as it relates to healthcare technology. We have never had any sort of financial relationship with a single EHR vendor. And that's something we chose to do a long time ago. And you'll hear Jeffery talk about that a little bit. And I think that why that's relevant is, or that's kind of indicative of why Jeffery is a well-known and kind of high-demand speaker at conferences all over the country, and has been for years, talking about the process of selecting a solution, vendor negotiations, contracting, and vendor relationship management, basically from the healthcare services perspective, so a medical practice or a hospital, and then also dealing with things like implementation, interoperability, project management, etc. And then finally, some of the more recent things we've been looking at and that I know Jeffery and his team have been doing a lot of work on are things like cybersecurity, dealing with the role of technology in the continuously growing and evolving value-based healthcare landscape, and kind of how that is going to impact technology and where health IT is going to fall in that whole dynamic. And then even on kind of the truly, what I think is truly the advanced side, is things like artificial intelligence or AI, and how that is playing more of an active role in the healthcare IT world. So really interesting things. The thing about me is I'm not a technology guy, but I've been around this marketplace and have seen enough going on that I think we're able to have a good conversation. But then Jeffery just is so familiar with what's going on and is able to just provide a great deal of perspective, especially for the clients we work with, which again are on the healthcare services side. So whether you're a medical practice or a hospital and there's something going on from an IT standpoint, I believe Jeffery's the guy, and he can at least speak to. There isn't much out there that he hasn't seen. So this is a great episode, and stand by for more as we continue this series. And we're going to be digging in very shortly into some of these specific topics that Jeffery and I talk about, at least from a high level in this episode. So thanks for listening, and be sure to check back for more content. Welcome to Coffee with Coker. In this episode, we have another guest from one of our Coker divisions. I'm here with Jeffery Daigrepont, who is one of our senior vice presidents, and Jeffery has been over our healthcare technology consulting service line for probably 20 years almost. So we've been doing a lot of work in that space for many years, but Jeffery is definitely one of those guys that everybody knows him around the community, and he has a lot of perspective. We want to do kind of what we've done on some other episodes where we give kind of a broader overview of a topic area that we can kind of frame and kind of, have a little bit more discussion on some of the general things going on. And like some of those other episodes that we've done, this will ultimately end up being a series where we can then kind of go and follow up episodes into more detail. That will ultimately be what we do here, and Jeffery will be featured in a number of different episodes in that series where we talk about technology and health IT. So first of all, welcome, Jeffery.
Yeah, thanks, Mark. Thanks for having me.
Yeah, jumping right in, I guess, since we are kind of covering this topic from a broad perspective today, before we jump in and talk about what healthcare IT is like today and what the current state is, just walk us through a little bit of the evolution over the last 10 to 15 years of how healthcare technology has evolved, changed, whether it's making progress or otherwise, I guess. But, what does that look like?
Yeah, I think, it's always helpful to kind of level set and to set as a backdrop what the evolution of healthcare IT has looked like. It's kind of fascinating. You can see this in many different industries, not just healthcare, even simple things like our entertainment. At one point, the 8-track tape player, right, was the latest thing, and then went to cassettes, then CDs, and now music just magically appears from the cloud and operates without any moving parts. So, healthcare technology is no different. We went through a long, frustrating era of what I would call the best of breed era, where you had good practice management, financial revenue cycle management systems that for the longest time, they were the system of choice. There were only a few handful of vendors, and then the EHR started coming into the market. And back then, it was just a standalone EMR and a standalone practice management system or financial management system. So that after we went through the best of breed, we went through about 8 to 10 years of what I would call the interfacing era, where people wanted to keep their financial systems. There were EMRs that were more specialized in certain areas, some that was designed for primary care, others designed for cardiology, whatnot. And so they started interfacing the systems. Well, that turned out to be a disaster because version control, keeping up with multiple instances, was very expensive. There was always the need to continuously fight that reconciliation.
Or find another solution, an entire different solution that allowed for, quote unquote, that interoperability, things like that. Yeah.
And then following the interface era, we had massive amount of compliance. And that's when you saw all the consolidation. And what compliance required, these were things like ICD-10, meaningful use, all the reporting analytics. Vendors were struggling because they had all this on-premise technology. How do you keep that current? How do you keep it modern? Again, very expensive upgrades. You might have even had to replace all your infrastructure because your old version didn't replace it. And that really drove us to what I would call the enterprise single vendor solution, or as we oftentimes will say, one throat to choke. One vendor that's doing everything. And because compliance continued to put pressure on vendors, and the internet was improving at the same time, that's really where we came to the era that we are today, which is cloud computing, because it just makes so much more sense that you can have a single instance of software that people can get access to remotely. Internet's now available everywhere. People are no longer uncomfortable using cloud technology. It is, in my opinion, where the market's at today.
Sure. Yeah. That's helpful. It's been interesting to watch that evolution as it's happened over the last, 10, 15 years plus. But what are your thoughts? I mean, you mentioned a couple of things there that I thought definitely play into how and why some of these changes occurred. But what about, it sounds like, or from what I've observed, some of the changes are also things that have happened on the vendor side as well, whether it's, consolidation or things like that. What are your thoughts on that? And then what are some of the other things that drove these changes?
Yeah. So as you go through, you have evolution that happens just because technology improves, right?
Sure.
And I think of all things that improve, I believe it's technology that's the fastest in terms of how, processing speed, things like that, how it doubles every 3 or 4 years and in many times gets even cheaper. But there was also some operational significant landscape changes in the market. These were hospitals buying physician practices, vendors who were either at end of life with their product, and in order to remain viable, they acquired other products. And so there was a lot of consolidation. There was also at this same time period a lot of incentives that was coming into the market. So vendor XYZ, in order to remain relevant, had to get compliant. Otherwise, they would become radioactive. And they had 1 or 2 options there. They could build it themselves, which was very expensive, or they could go buy another product and merge it in. And in some instances, there was a lot of mergers and acquisitions, both happening on the vendor side, but also on the ambulatory hospital physician side. And one real key element, if you kind of observe it very closely, the transitioning was largely hospitals buying physician practices, meaning the hospital inpatient systems that were in place now all of a sudden had to do ambulatory. And that's where you saw a lot of the bigger vendors get acquired, or vendors like Epic, McKesson, and others begin to build out and more aggressively accelerate their ambulatory solutions. Epic was always did inpatient and ambulatory, but there were others that only did inpatient, others that only did ambulatory. But the trend in the market was vendors who could do both started becoming much more mainstream and much more attractive to buyers.
Well, it's interesting too how consolidation of the user, the end user, that being, like you said, the
buyers,
hospital,
right.
the buyers, the hospitals and the physicians kind of coming together through consolidation drove further consolidation on the vendor side in terms of whether they're merging solutions or, like you said, expanding capabilities on their platform.
Right.
All right, so let's talk about kind of where we're at today. What do you think? What are some examples of current trends and things that we're seeing if we look at the landscape?
Yeah, we touched on it a second ago, but clearly cloud technology, not just in healthcare, but really at this point, I can't think of anything, and I'm really thinking hard of what we do from a traditional or old school on-premise loading a disk in a computer. That just doesn't exist. In fact, most of the computers today don't even come with CD-ROMs. I mean, it's because the software is just all we download or we access it. So cloud is nothing new, and I do want to clear up a couple of little misconceptions. Because cloud is a buzzword, there's all kinds of variations of it. A lot of vendors have what's called hosted systems, where it's basically your on-premise software running in their data center. In my opinion, that's not cloud. Cloud is a true multi-tenant, single instance of software where you would not be able to operate it on-premise even if you wanted to. And it's usually one instance, one version of software. The advantage of that is highly scalable, very accessible, doesn't cost much to install because it's already running and operational. The disadvantage of that is that you tend to have to accept whatever's there, and your customization may be limited. I always use the example, try calling Facebook and asking them to move your profile picture from the left to the right. It's just not going to happen. Try asking them to change it from blue to red. It's just not going to happen. So sometimes when you're using cloud type technology, you have to, the advantages are clearly it's accessible, scalable, but it is what it is, and you have to accept it. Another significant area, in fact, all of meaningful use, MIPS, MACRA, in fact, I think it's even being rebranded by CMS around interoperability. Despite the fact that we've had all this automation, we're still very fragmented. Just because you've automated doesn't really bend the cost curve unless 2 caregivers can share data, because that's really where the bulk of our cost is. They're not able to communicate. Still very expensive. We're also seeing things like analytics finally getting the attention that it needs. Big data, the belief by many experts, not just in healthcare, is those organizations that have a good grip on their data will be the ones who are going to be the most successful in the future. And not to mention, our future reimbursement, the way we get paid, is all going to be predicated on showing good outcomes, which you'll need data for doing that. Some of the really cool stuff that's sort of yet to be seen, but is definitely starting to show up, are things like the wearables and consumer-driven products. Now that we have technology that can monitor our sleep, our heart rates. There's even some really, science fiction type stuff where you swallow a small microcomputer and the computer goes through your system. I guess it comes out the other end, but when it does, it comes out with all kinds of analysis and diagnostic results. And so I think we're going to see more of that. I also think that there's a huge appetite by consumers for apps, and they want to be integrated with their healthcare. And I think doctors, and in fact, you're already seeing this, part of interoperability, part of the incentives does require electronic communications with your patients. And I think that's going to be done through apps and secure messaging of that sort.
Well, I think there's a couple of things there. One, I think we've never seen the consumer of healthcare so engaged in the delivery process, kind of engaged in their information from their provider, but also their own data and information. And that comes through the apps. And I think the other thing there, and you kind of alluded earlier to improvements in connectivity. And I think that's obviously a big component of this shift to the cloud-based environment. But at the same time, I know one of the big questions comes up around, well, what about security? If it's out there on the web, can we be 100% certain that it's secure?
Yeah, and in full transparency, we probably should discuss the dark side, right? Which is cyber criminals, and the more automation that we adopt, the more vulnerabilities. What I think terrifies a lot of health systems is that the bigger corporations like the Equifaxes, the Sonys, the Targets that have been attacked have really aggressively hardened their data centers. I mean, by measures tenfolds of anything a doctor or hospital will typically do. So hospitals and physician practices tend to be soft targets. They're also very data-rich targets. And if you're a cloud vendor, that's even more attractive to a hacker because they could hit one place and get to hundreds of thousands versus a single office. So we're going to talk, actually, the next series will be vendor contracting, which I'll just say now, I would not sign a contract with a cloud vendor without proper security protection, because part of the reason of going with a cloud vendor is you're trying to take some of that burden off yourself. You're ideally going into a data center with all the proper security and protection, but security has to be on the forefront. In fact, we'll talk more about this in the next section, but it's clearly a matter of when. It's not if.
I think we will talk about that, and I think there will be a lot more discussion, because I know a lot of the things you're doing, your team, and working with clients is specifically on the security side to ensure that, like you said, there are questions. You have to consider the negatives, the dark side, like you said. But there are a lot of measures where, like, companies are really making great strides and able to secure and ensure that data remains secure. Because, and you talked about the analytics and the data. There's such a tremendous value on the data that is collected through all of these solutions. And, whether it's health data, financial data, statistics, whatever you can think of, there's tremendous value. And so there's value on the positive side, where it gives us a lot of opportunity to make improvements, to, monetize whatever. But because there's value on that end, there's also value on the folks that want to come in.
And I would say the biggest area that we're seeing emerge in the market as far as activity, buying activity, transactions. I mean, at this point, most everyone has an EMR at this point. And one of the things that we've learned is that EMRs are helpful, but they're just really big repositories of information. It doesn't really produce anything meaningful unless you get in there and mine the data.
Right.
And what we're finding is that doctors weren't always, and even health systems that had a lot of focus in this area, they weren't standardizing their data. They didn't put it in a structured way. Maybe they were dictating or using scribes. So even though there's capabilities there, they didn't have the right structure or format to go into it. They didn't have this, the first challenge with an EMR was just getting a doctor to use it without hurting his or her productivity. And that, in many ways, trying to simplify ease of use has created challenges that are now showing up today, because that meant that doctors were being allowed to dictate or use unstructured notes or handwrite and scan in. I have clients all the time that tell me they have an EMR system, but what they really have is a document imaging system where they're scanning their handwritten notes in. And that's just not going to get you to where you need. So the way we enter the data is going to be
Well, that's a good point. One of the things, so we had another previous episode with Dr. Mac Knight, who, of course, is our chief medical officer, and he leads a lot of our value-based healthcare consulting that we do. And so one of the things that came up in there is that you cannot, there's no way to move forward with this value-based healthcare model, whatever that ultimately ends up looking like, and what we ultimately end up calling it. But there's no way you can do it without the technology in place. So just, I don't know, where do you think we are in terms of that volume to value shift, and then kind of where the future of health IT is going to fall within that?
I couldn't agree more. I think we're definitely moving on that path. It's also, in fairness, clear to understand we still are very much in a fee-for-service world. So we're kind of in between. I know the goals set by CMS have been very aggressive, and they've been moving towards that. You are starting to see various components, whether it's through the incentives, the PQRI, some withholds that are starting to happen. So it's beginning to show up, not just with CMS, but even commercial payers. And let's not forget, we oftentimes think, well, how do they get the data? Well, you submit claims. And the question I have for clients is, do you want your payers judging your outcomes based on the claims that you submit or the actual outcomes of your patient? Because claims data only really shows what you did, not what the results were. And I've actually seen doctors unfairly targeted because of, in fact, we had a client, an OBGYN, that was actually kicked off of an insurance plan because her cesareans were significantly higher than other doctors based on claims data. So the implication there was that quality was not good, right?
Sure.
However, no one seemed to recognize and noted that she was a high-risk OBGYN physician. So naturally, she got more breech babies, more twins, more complicated cases. So little things like that, if you allow the payers to use claims data, I think you'll regret that, and it will not do you any favors. So you're going to have to produce your own data.
Yeah, really good point. What else is on the horizon, you think?
I'm just kind of fascinated by this, but it's the artificial intelligence. I mean, we're seeing it. I don't know if you guys get these calls, but they are good. I mean, it sounds like a real person. They
voice
can pivot the voice.
Yeah.
They can pivot their responses based on what you say next. It can trigger a whole series of secondary questions. We now have these devices in our home that just listen to us, that will do certain things. And so people are now beginning to explore how that might impact healthcare. At the point of care, you might be able to have a Lexus-type listening device in that exam room where certain interactions with the patient might start proactively triggering treatment plans, protocols, standards of care, alerts that might pop up. Our interaction on the internet, too, is being carefully monitored by all kinds of data aggregators. Everything from what we buy to what we do, our lifestyle, even down to our politics is being monitored. And so, a lot of people are studying now how to bring that kind of data into the folds of healthcare. I think that you might even get to a point where computers can start predicting certain outcomes based on these algorithms that they'll study. They certainly are now doing that in other industries.
Sure.
You can almost, in fact, I don't know how.
Amazon, what you're trying to say is Amazon knows way more about me than probably I do.
and there's some people that actually think, and I've actually verified this on my own, they can even pivot their pricing based on your buying. So they know you're an impulsive buyer. You might actually get shown higher prices than someone who tends to be a little bit more scrutinizing of different options. So that kind of intelligence is being tracked, and it's just a matter of synchronizing it and applying it to healthcare. I also think that we're going to see a big shift away from the traditional financial management system. Let's key a charge, let's enter a code, put a price in there. I think we're going to see clinically driven revenue cycle management, meaning that the reimbursement is going to come from the outcomes, from the quality, from the level of documentation, and they're going to be looking at things around shared savings, so value-based reimbursement.
Yeah.
So the whole concept, and that's where I think in some ways a lot of these vendors are designed around a percentage of revenue based on a paid claim. And so they're going to have to start looking at how they're going to shift their models to how do they contribute in a world where doctors are paid on outcomes.
Well, if you think about a hospital, if they're going to increase the volume of risk-based contracts, managed care contracts that are risk-based, and then they are going to need all the help they can get in terms of maximizing their process, their engagement in order to minimize that risk, meet those quality indicators, and be able to reach those incentives in those contracts. Right. It's not just, like you said, a price and a fee schedule.
Right.
Or a code and a fee schedule.
That's why I think we'll see more of a shift to the financials being driven from the clinical side more so than ever before.
Yeah, I think that's great. I think it has to. Everyone knows the purpose of our podcast is not just to come on and sell Coker services or pitch, and make it too much marketing like that. But I do want to give you a chance to talk about what do we do in our healthcare technology consulting service, and maybe start with things like when you're looking at clients, what should they be doing to prepare, and whether it's a hospital, a group, or whatever, they're already going to be engaged in technology in some way.
Yeah.
So kind of maybe let's talk about what they should do to prepare, but in the context of kind of how you're working with clients.
The very first thing I tell clients, Mark, is let's not overreact. I mean, we've seen horrible examples of the market over-responding, Y2K, HIPAA, all these kind of trends that people thought, the sky is falling type stuff.
Sure.
So one of the first things that we try to do is look at what is current capabilities. Because if we could leverage existing technology, whether it's enhancements, redeveloping, maybe it's a module here or there, that clearly is a lot better than trying to rip something out and reinvest. This stuff is fairly expensive. Costs a lot to not only purchase, but you got to implement it and then manage it. So I think the key is let's see what the current capabilities are. And then what I would say is extremely critical is, and this is something we have a great deal of visibility into, what is the actual life cycle of that product? A lot of times people make the mistake of assuming that they are hitching their wagon to something that can take them to the future, where the vendor has already commercially discontinued, or that technology won't even come nowhere near supporting those requirements. And it's all about timing. And you can make the error of becoming obsolete very quick if you're not honest with yourself about life cycle. Every product has a life cycle.
Sure.
And knowing where you're at in that is now does that mean you're no longer doing business with the vendor? No, it may mean that you need to look at their roadmap, their next version. I know 3 or 4 vendors today that are still selling their legacy version while they've already went out and acquired new products to replace that. So if you're in the market to buy, that's there's no worse feeling. And this isn't just in healthcare. Can you imagine, even if you went and bought a TV, only to learn that the next best one comes out a week later and it's, half the price. So, knowing where things are at in the life cycle is
and not to dog any vendors or vendors in general, but the reality is there are a lot of big promises made trying to sell that solution or that platform or whatever, and they don't always play out for the end user the way it's kind of framed in those discussions early on.
And as we talked about already, everything has evolution and life cycle.
Sure.
So every vendor, goodness knows, Microsoft has made billions of dollars every 2 years, a new version of Windows. But it's important, but they usually are providing those release notes 2 to 3 years ahead of time. They kind of give you a schedule when one's going to be sunsetted, the other one's going to come in. So it gives you, the buyer, at least some awareness of where you're at.
Sure.
What I see as a big problem in our healthcare IT industry from the vendor perspective is they are a lot of times very aggressive to recognize revenue. Maybe it's very competitive, market share. Sometimes there's salespeople that just over promise, as you said, and they got quotas, and so they do take advantage of buyers, and it's unfortunate.
Well, one of the things too I know is this is particularly relevant, I think, on the hospital side, but because I don't know that we can legitimately say there truly is that one-stop solution for everything.
Right.
And so we know, even if there is one out there, in most cases of a hospital, you're just inevitably going to have to deal with multiple solutions,
Right.
multiple vendors, multiple platforms, whatever. So how does the whole concept of understanding interoperability play into
Right.
that?
And actually, you took the words almost out of my mouth, because I was going to say the next critical thing that we would engage or recommend is looking. We already know interoperability is going to be key. We already know data analytics is going to be extremely necessary. And we know that you're going to need to have patient engagement, electronic patient engagement. That's all part of the compliance requirements. And so we begin looking at the gaps between what they have versus what they need. And in some instances, they do need to reinvest in more modern technology. But then again, there's times where they have everything they need. They just need to build it out and further invest in what they have.
Sure.
So again, don't overreact. Look at what you have. Study and be obsessive around the key elements that's going to be necessary for you to be successful in the future. I don't think you need to go through an exhaustive vendor vetting of, how does it handle blood pressure? I mean, this point in time, the market's fairly mature. A lot of evidence of these products working. Look in and focus on the critical things that are going to be necessary for the future.
Yeah. Since we are kind of talking about some of the things you do with clients, and we've alluded to the vendors that are out there, I'd like you to make kind of or comment on this one point that, for us being Coker and this work that we do, comment on kind of how we have always, from the very first, time we got into healthcare technology, have made the decision to remain independent, no financial connections to any one single vendor. Credibility.
I'm so glad you brought that up. I actually made a note to myself to actually say that at the very beginning.
Yeah.
And I guess we just have always lived that for so long that we sometimes forget. But to Mark's point, we have maintained a very strict policy here at Coker that we will not have any financial affiliations with vendors. We just think it's not ethical. If you're going to be an advisor and recommend products, then you do have to be at arm's length. And now it's not to say that we don't gain certain amount of expertise and knowledge. We have certified staff and various vendors that know how to perform certain duties. But there's never a situation where we would recommend a product where we have anything to gain financially. It's just not right. And if you are going to work with consultants, I would, whether it's us or anyone else, I'd make sure that they are truly non-biased and objective in that way.
Yeah, because at the end of the day, like you said, the technology is such that it's not that there's anything really new. I mean, there will be new stuff, but in terms of kind of the fundamental framework of the technology a lot of our clients are dealing with, the decision on which vendor, which solution you go with has to be based on the individual needs and the individual situation you're dealing with.
And we've had a lot of evolution within Coker. I don't mind telling you that we do very little vendor vetting today. It used to be almost all we did. Now, we still do it in the context of a EHR to EHR conversion. There are certain markets like critical access health systems that are going more aggressively into the market. A lot of the FQHCs were early adopters. They're now in their second, third generation, so they're back in the market. But if you look at the big major health systems that have invested millions, they're going to be their vendor decisions made for them.
Sure.
And oftentimes what we're doing in those instances is onboarding, data migration, legacy app retirement, cybersecurity, optimization. A lot of times we see people that have spent a lot of money, but they don't use the technology correctly. Mm-hmm. So optimization now is a big part of what we do.
Yeah.
As far as the general strategy, again, I want to reemphasize, don't overreact to it, but it is, even if you feel like you have the most modern system, it may still be designed incorrectly. So it's always good to have an objective third party look at it.
Yeah. You. Absolutely. Well, this has actually been really helpful in terms of framing this discussion, because again, I think it's helpful to start there at kind of that big, broad perspective, and then we can drill down. So I know in terms of some of the follow-up discussions we're going to talk. Actually, we're going to have our first kind of subsequent discussion is going to be focused on 5 fatal mistakes of an IT contract.
Right. Yeah, I think this was a great backdrop to that. Clearly, if you're going to start modernizing and investing in technology, you want to do it in a way that doesn't create any risk for yourself personally. Sometimes people oftentimes refer to this as a career-defining or career-limiting decision. So it definitely is one of the bigger decisions most people make in their careers, and it will and can have a very positive or negative impact on your organization. So the next talk will be on, there's obviously lots of contract modifications, but we are going to try to narrow it down to the top 5 most critical.
And some of the other things I wanted to talk about on future episodes is, we're seeing a lot out there where it's not so much about how revolutionary a particular technology is or any one solution, but what is interesting is how our clients are able to optimize solutions and their technology in a way that helps them either provide better care, better, improve kind of lifestyle for the providers, generate greater economic benefits for the care that they're providing. Right. So, kind of financial benefits there, and just other things, particularly as we kind of, obviously a constant theme is going to be as we do move more to kind of a value-based care model, right. What the technology can do to facilitate that better.
Yeah, one of the top questions I get, and we'll definitely should cover it in a future podcast, is exactly how do I prepare for value-based reimbursement?
Right.
What kind of system configurations? How should I manage my IT investments to go? Like, give you a classic example. Pop Health is a module that people oftentimes are interested in, but then there's some overlap with the health information exchanges, a shared community health record that might already be in place. Maybe there's an ACO. So how do you sort all that out? And do you even need a Pop Health if you're in an ACO? Does the ACO provide the Pop Health solution? So there's a lot of gray area in the market that we definitely should discuss.
Well, even as we think about MACRA, when we talk a lot about MACRA prep or MACRA readiness. I mean, there is no MACRA readiness without the specific data that's required and the ability to report it, which is, seems like kind of a straightforward thing, but isn't always the case. And so,
and I even learned as recent as a couple weeks ago that you can now become an approved registry on behalf of CMS to report on behalf, or your product should be compliant with that. So vendors oftentimes say, well, we'll help you be compliant, but do they have the direct pipes to feed it back to CMS? Otherwise, you might be left with still the burden of who's going to do the reporting. And so just because you have the data still doesn't mean you have to attest to it and you have to submit it. And those are all additional steps that could be automated.
Well, good. Well, obviously, a lot to talk about, a lot more content coming. So we want everyone to kind of stay tuned for that. And so we'll look forward to getting you back on that real quick. And we'll make sure in the show notes that your contact information, where to find you on social media and all that stuff. But I know one of the things you spend a lot of your time with, Jeffrey, is going and speaking, because I know you're very high demand in terms of speaking on these topics at conferences and stuff. So just real quick, what are some of the things you're speaking most about these days?
Yeah, I've actually had 2 requests for the artificial intelligence topic. And so I'm excited to start seeing more interest in that. I'm doing a lot on cybersecurity right now. That seems to be a high priority. And also how to do data migrations in the event of a merger.
Yeah.
And I guess mergers are still happening, and people get stuck with 5, 6, 7 EHRs if there's no real strategy. App retirement is another big topic. What to do with all this legacy. Back in the old days, we would just copy the paper and store it, and now people have to actually retire things electronically. And so that's that's probably a whole nother series of how to go about retiring your old technology.
Yeah, absolutely. Well, great. Well, like I said, we'll look forward to continuing the discussion on some of these more specific topics. But in the meantime, thanks for kind of teeing it up for us, and we'll look forward to having you back.
Yeah, thanks for having me. Enjoyed it.
Great. Thanks, Jeff. I hope everyone enjoyed that discussion with Jeffrey. I think it was very enlightening and intriguing on a number of the things we talked about. And as I said in the intro and throughout the discussion, there's definitely going to be more content in this series as we talk about health IT. So we'll hear more from Jeffrey and some of the others that work with us in that group and some of our partners. And so I want to, though, encourage all of our listeners to, we love to hear from you, and we really like to engage with you guys. So We really welcome all kind of feedback from our listeners and followers on social media. Please feel free to contribute with any questions, or if you have an idea of topics or material you'd like us to discuss in future episodes, please send those to us. You can reach out to us directly. feedback@cokergroup.com is an easy email address just to send suggestions or ask questions. Maybe even easier than that, you can also reach out to us through social media. So on Twitter, you can find us at cokergroup.com, COKER group. And then on LinkedIn, you can search for Coker Group and find our company page there in LinkedIn. Also, our website at cokergroup.com. And then if you want to go directly to where to find the podcast, you can actually go to coffeewithcoker.com, and that'll redirect you to that page. So you can find all the episodes there, and you can get more information about this specific series on health IT or any of the other series we're doing in the podcast. So again, we thank you all for listening. We welcome your feedback, and we really look forward to engaging with you all through social media and on future episodes.